Right, my name is Gregory. I've worked at Evolve for 18 months now. Been involved in dentistry since 1973 when I left school. So I used to make model aircraft as a young teenager. I just loved it. All my Christmas present list was always model aircraft. People of a certain age group with no airfix kits. And I got to the age of 16 and I realised I had to do something for a living. I was going to leave school at 16, so my mum, bless her, found out that our local dentist, family dentist, had a technician who worked on the premises. So she thought, as I like making models, maybe I'd like making artificial teeth. So I spent a day with him and thought, if I could do this for a living, it would just be amazing. So that's how I got into dentistry, basically, to start with. That was in 1973. The bit that I really found interesting was dentures. I mean, there's a lot of the laboratory stuff is, and my training was based in making dentures, crowns, orthodontic appliances. And dentures are almost the most artistic part. You can just transform somebody. And it's a bit like making model aircraft. You can make stuff look so clever and so realistic. And it's just so satisfying to make people look like they've got real teeth rather than dentures. I just try and instill that in the teaching I do. So if somebody wants dentures or they've got old dentures that need replacing, the most important thing from my point of view is finding out what patients want. It's no good when we saying what they need. You need to find out what they want. So we create something called a wish list. So we ask a couple of sort of opening questions. What would they like for the treatment? How do they want to look? How do they want to end up looking? And then we write that down and then we work out whether it's achievable. So you have to be realistic. Some people want the earth and we can't quite do that. But in most cases, people just want to be comfortable. They don't want to advertise the fact they've got false teeth. So you work out a wish list. A wish list would include maybe that's what they used to look like when they were young. So come along with a photograph, I look like this when I was 25. They don't want to look 25 again, but they want to look like the same teeth they had when they were 25 years, which is entirely reasonable. So that's the sort of way we start our treatment. So it's a talk to start with. We don't do any dentistry on the first visit unless they're desperate. We try and work out what they want and whether we can achieve it. And it's not often we can't. Working at Evolve is great. Carol opened her practice 3 months before I opened one locally. I came on Carol's open night and she knew about me, but didn't really know me that well. And we got chatting on her open night and she just does not like it making dentures, and I do. So for 9 years, Carol sent me virtually all the denture patients she had here that she thought were tricky and challenging to me in Nailsy. So when I sold my practice and packed in work, 6 weeks later I thought, I'm bored. I was doing the teaching job 1 day a week and 4 days a week doing nothing. So I gave Carol a ring and said, do you want me to come work with you? She just jumped at the chance. So I've been here for 18 months and it's just great. Great lady to work for. I've got Jess, my nurse here, who used to work with me in Nailsy, so it's just, you know, home from home. Great working environment, great staff, nice patients, and I can do what I want to do, which is give people nice smiles.